Hi everyone, welcome to another question and answer session. A 63 years old female is referred to the surgical clinic with an iron deficiency anemia. Her past medical history includes left hemicolectomy, but no other comorbidities. At what site is most dietary iron absorbed? So it is direct question that we have to find out this site, that means the gastrointestinal site at which most dietary iron absorbed. And this scenario is not important for this question because here we can see 63 years old female referred to surgical clinic with iron deficiency anemia, and past medical history include left hemicolectomy but no other comorbidities. But they want a direct question that we have to find out the site of most dietary iron absorbed. That means we have to find out the iron absorption site. Here the options are stomach, duodenum, proximal ileum, distal ileum, and colon. So now see the iron. So here the iron metabolism. Iron is best absorbed from the proximal small bowel, that means the duodenum and jejunum in free iron state. So here the iron is best absorbed, that most of the iron absorbed in the duodenum and partly by the jejunum. So these two important side, one is the duodenum, another one is the jejunum. Then iron transport, it occurs across the small bowel mucosa by divalent membrane transporter protein, and hence the improved absorption of the iron 2 plus. So iron 2 plus or ferrous form, it is transported through the membrane because there the divalent membrane transporter protein present. It is the divalent. For this condition, the ferrous form of iron is more absorbed than that of ferric form. Intestinal cell typically store the bound iron as a ferritin for a definitive time, and their cells requiring iron will typically then absorb the complex as needed. Here we can see, so iron metabolism, it occurs mainly in duodenum but partly in the upper jejunum. About the 10% of the dietary iron is reabsorbed, and about 90% of the iron it is excreted through the stool. And here we can see Fe2 plus, that means the ferrous form of iron better absorbed than the Fe3 plus, that means ferric form, because presence of divalent transporter in the intestinal wall. Ferrous iron is oxidized to form ferric iron, which is combined with apoferritin to form ferritin. And here we can see absorption is regulated according to the body needs. If we need more iron, then more iron absorbed, and if we need less iron, then less iron absorbed. And it is increased by vitamin C and gastric acid. So the iron absorption, it is enhanced by the vitamin C and also by the gastric acid, and it is decreased by different products such as the proton pump inhibitor, tetracycline, gastric achlorhydria, that means the absence of hydrochloric acid in the stomach, and tannin, which is found in the tea. So tea, proton pump inhibitor, tetracycline, gastric achlorhydria, they are responsible for reduced iron absorption. And here we can see the transport. Though the iron is absorbed the ferrous form, but during the transport through the blood or in the plasma, it as a ferric form. So as a ferric form, it transported in the different part of the body, and the storage as a ferritin or hemosiderin in the bone marrow. And it is excretion, very less excretion, and it is lost via the intestinal tract from the de-squamization. So the release of calcium or excretion of the so release of iron or excretion of the iron from the gastrointestinal tract to the outside of the body, from the body to outside of the body, it is very less, and it is usually occurs by the cells of gastrointestinal tract during the de-squamization. So iron overload is not good. And here we can see the distribution of the normal body iron. So here we can see the total body iron, it is 4 gram, among them 70% as a hemoglobin which is present in the red blood cell. Then the ferritin and hemosiderin form 25%, myoglobin 4%, and plasma iron very less, which is the 0.1%. So our answer is now ready, that the iron is most absorbed in the duodenum and part of the proximal ileum. So it is all about the iron absorption. Thank you all.